Hello, I'm Timothy Clark, an interventional radiologist and professor of radiology at the University of Pennsylvania. Why is critical limb ischemia associated with such a high mortality rate after major amputation? One of the major concerns we see in patients with chronic limb-threatening ischemia is that they are without the necessary blood flow to their lower extremities. They're at ongoing risk of skin ulceration and skin breakdown. And these so-called ischemic skin wounds can progress to a local infection of the skin and soft tissues called cellulitis, which can be extremely difficult to treat without enough blood flow and even with appropriate antibiotic care. It can lead to gangrene, which is a complete lack of blood flow to the skin and soft tissues. It can lead to erosion through the skin and exposure and infection of the underlying bone called osteomyelitis, or the surrounding joints formed between bones, and that's called septic arthritis. And each of these things can contribute to the need for major amputation when nothing further can be done because there simply isn't enough blood flow to the foot and ankle. Major amputation is defined as amputation above the ankle joint. What we see now in the United States is after a major amputation, there's a significant increase in mortality, that is, death. In a major study of over 3 million Medicare beneficiaries, within a year after a major amputation, almost half of those people were no longer alive. And within 3 years of major amputation, over 70% of these folks had died. Some of these deaths can be accounted for an increase in risk of heart attacks and stroke, both of which are higher in patients with critical limb ischemia. But just the risk of dying from the major amputation alone is secondary because of other factors. One becomes a permanent fall risk, and a major fall can be fatal in some people. One's mobility, one's respiratory, breathing function is affected after a major amputation. The underlying amputation stump can lead to skin erosion, skin breakdown, exposure of the underlying bone, infection of the underlying bone called osteomyelitis. So all of these factors alone and in combination can contribute to what we see as this major death risk, major increase in mortality after a major amputation. So our common goal is to help restore blood flow to the lower extremities, to allow these wounds to heal and prevent the need for major amputation. You can find out more how to find an interventional radiologist by going to sirweb.org/PAD.